to wash my hands and pull the curtains and assess the situation. Make sure I have my PPE risk, safety risk, and ask my general survey questions. I'm going to introduce myself. Hi, my name is Mijito Arthur. I'm the registered practical nurse here to help assess you. Okay, before we start, can I get your name and date of birth? Okay, I just checked your name identifications and I'm confirming you're the person you are. Do you know the date? Correct. Do you know what year we're in? Correct. Do you know where you are? Correct. And do you know who the Prime Minister is of Canada? Correct. Can you tell me what brought you in here today? Okay, I understand. So we're going to begin with the neural assessment. Anything that we do will be confidential, and you can let me know who you want and who you don't want to know who you want, you don't want to know about your care. Okay, so you have the right to accept or decline or ask any questions, okay? Do you have any questions before we start? Okay, great. Can we proceed? Okay, great. So I'm going to start with some questions. Are you in any pain or feeling any dizziness? No? Great. So when did the weakness begin? This morning when you woke up? Where did you feel the weakness? In your arm? Which arm exactly? Your right arm? Okay. Did the feeling spread anywhere? No, it didn't. Okay, thank you. How long did it last? You had a brief episode of weakness? Okay, I understand. Thank you. Do you have any histories of seizures or strokes? No? Okay. Are there any other feelings of the symptoms that you received that you may feel like is important for me to know? No? Okay. And have you had any head injuries or concussions? Okay, great. Thank you. We're going to begin. I'm going to just check your heart rate and take your vitals, stethoscope, blood pressure, O2 stat, respiratory, pulse, temperature. Yes. Okay, so now we're going to begin with the neural assessment. Is that all right? Okay. If I assess the patient's olfactory nerves, I would occlude one nostril and have them smell something, and then that would tell nerve one. Do you have any issues with blurred vision or dizziness? Okay, now we're going to check nerve 2, which is the optic nerve. I'm going to use the olfactoscope to look at the optic nerves and the optic disc. And then I'll be assessing nerve 2 and 3 and be looking at the pupillary reaction. I'm going to be watching for constriction of both eyes, direct and consensual on both eyes. They're equal, round, and reactive to light. Now, I was going to check the cranial nerve 3, 4, and 6. This is the 6th cardinal field of gaze. I would like to ask you not to move your head and just your eyes. Great. Now I'm going to ask to see your nerve 5. Please clench your teeth and move your mouth side to side. Nerve 7. Can you please smile? Can you blow your cheeks and frown? nerve 8. I'm going to whisper test, or I can assess how we communicated as the patient has been talking to me throughout this assessment. And if they're showing any signs of difficulty of hearing, like saying, pardon me, huh, I will be able to see it. Next, I'll look at the nerve 9, the glossophilia, and nerve 10, the vagus. I'm going to ask for the patient to swallow, open their mouth, and say ah. Here, I'm looking at the uvula, if it's midline, because people with stroke often have dysphagia or difficulties swallowing. Next, I'll be looking at the cranial nerve 11, which is the accessory or the spinal accessory nerve. Spinal accessory. I'm going to place my hands on the patient's shoulder. I'm going to ask them to shrug. Now I'm going to look at cranial nerve 12 and ask the patient to stick their tongue out. Usually if the tongue deviates, is where the injury is. If the tongue goes left, the pain is usually on the left side of the body, and vice versa. Now, while looking at the motor, I could see that she was able to have appropriate gait when walking into the room. Her stance was appropriate, and her posture is good from assessing right now. I'm also going to look if she has any tics or signs of atrophy or obvious abnormalities. Now, I'm going to look at her range of motion. Move her arms to see the tone. The range of motion is skeletal, but the strength is neural. And now I'm going to ask the patient to open their hands and go against me, and vice versa, against my resistance. Now I'm going to ask for the patient to make a fist, for you to make a fist, and try to push down on my hands and push up on my hands. And now I'm going to ask for you to bend your arm by your elbow and push your elbows inwards and push your elbows inwards and outwards. Now I'm going to ask for you to push your legs out and then in. And do a dorsal and plantar flex of the feet, going up and down, going against me. It's important to compare one side to the other so you can assess it. So this patient is a 69-year-old female patient who suffers with a transemic attack on TIA on December the 6th, 2003. The patient was admitted to George Brown Hospital and reports a brief episode of weakness of the right arm this morning when she woke up. Current symptoms is that she's experiencing regained strength in her arm and has no difficulties, neurologic difficulties, and has the strength to walk independently. My observation is that there's no noticeable defects of the limbs. Her muscles are within normal range. Her range of motions within normal range. Her gait analysis was in normal range, as well as her balance. There's no impaired balance or difficulties performing activities. The patient exhibited signs of TIA, has been recommended dietitian and physical activity to improve health. Patient was given medication list from MD. Education was given on anticoagulant medications. Patient has received on stroke recovery information. and support and programs to support her health, and will continue to take prescribed medications, prescribed from the MD, and follow up in 2 weeks. ASA, also known as also known as acetylsalicylic acid, aspirin. It's a non-steroid anti-inflammatory medication, NSAID. It's used to reduce pain, fever, and or inflammation, and arthritis. Arthrothrombotic, prevents clots and from from growing and forming. The mechanism of action is that it inhibits the activity of enzymes and the called the cholecylic COX, which leads to the formation of prostaglandin PTS. This causes inflammation, swelling, and fever. Specifically, inflammatory conditions it's used for is like pericarditis and fever. And people who take the medication may have increased tendency of bleeding, bleeding in the stomach, upset stomach, nausea, heartburn, and vomiting. And may also cause less side effects in the liver, kidney, and neural problems. Those who have bleeding disorders like hemophilia or vitamin K deficiency and uncontrollable blood pressure or severe liver and kidney disease should avoid taking ASA. Aspirin should also not be used by someone who's prescribed blood thinners such as warfarin or naproxen or ibuprofen and Advil. It's important to assess one side to the other so you can understand the differences in the strengths and weaknesses, especially with the stroke patient, because one side is usually compromised versus the other. Luckily, this patient here was able to be neurologic and physical decrease was able to be improved over time, and it was short term. Okay, thank you. Oh, scrubs. Thank you.